I want to talk to you about female support nutrients. Here's what happens to women at menopause. There's a 90% decline in their estrogen synthesis and a 66% decline in progesterone. And because that happens, the body's trying to get another ovulatory cycle going, another menstrual cycle going, so it over-secretes other hormones like FSH and LH. It's a bit complicated. But the over-secretion of those hormones cause hot flashes, night sweats, insomnia, mood changes, and a feeling of being unwell, just not feeling yourself anymore. So medical doctors thought that it would be a good idea to put estrogen and progesterone back into the body to shut off this cycle, and it works extremely well. The problem is that taking those prescription drugs for menopause have been shown to increase risk of breast cancer by 26%, increase risk of heart disease, and also increase risk of stroke. And so a lot of doctors today really are reluctant to prescribe hormone replacement therapy unless it's absolutely necessary. But here's the thing to know, that before there was prescription drugs of this kind, doctors in this country used to use black cohosh, a natural herb, to manage menopausal symptoms. And it works really well because black cohosh contains natural ingredients that have sort of a weak estrogen-like of effect. So they tell the body there is some estrogen in the body, so it shuts off the oversecretion of other hormones that lead to hot flashes and insomnia, night sweats, feeling unwell. And what we're learning subsequent to this is that soy extract can do the same thing, and so can gamma-arasenol, which is a natural ingredient from rice bran oil. And the soy extract also helps to lower cholesterol and to support bone density so you don't lose your calcium so easily from bone. These are all really great side effects. So what I've seen work for women who are going into the menopausal years is to take a combination product that contains black cohosh, soy extract, and gamma-arasenol all in one supplement, but it has to be the right dosage and the right standardized grade in order for it to be effective. The great thing about those three ingredients is that not only do they work, but they don't have any drug-nutrient interactions, so you're not going to get into trouble if you're using other drugs at the same time, and there's no bleeding disorders associated with them. You see, the problem with other herbs that manage menopause, like Angelica species, which is donquay, or licorice root, or red clover isoflavones, they all work very well, but they also cause an anticoagulant effect and can cause a bleeding disorder. Some of those have caused bleeding disorders, and licorice root also can raise blood pressure, so it's a bit tricky. I think those are dangerous herbs. You should stay away from them. The other great thing about black cohosh, soy extract, and gamma-arasenol, in younger women it can help to manage PMS, painful menstruation, uterine fibroids, and endometriosis. Can't totally cure it, but can help to manage it in a way that makes your life a lot more comfortable. So these are really important female support nutrients that younger women and older women should know about to help manage some of these hormonal imbalance problems. You can learn more on this subject by going to meschinohealth.com and reading the literature that I have available for you there.